Welcome back everyone to my channel Tooth Wave. Today I will be guiding you on a very important topic named fluorides. It is a very important chapter in your public health dentistry as well as it has a very important aspect regarding your NEET MDS exam. So let's begin. In perspective to a NEET MDS exam, I will be teaching you very precise and important content which is important for your preparation. So, first, this is a flow chart in which I will be telling you important dates and about what was discovered at that time. So, let's begin. You will have to learn these dates. So, in 1901, you will have to remember about Colorado stain was discovered by Dr. Frederick Mackay. You will observe various MCQs on this point in your pulse. So please do remember this Colorado stain. Then is dentine dye share. It was discovered by J.M. Eager. Then mottled enamel. It was coined by whom? Dr. G.V. Black. I'm telling you guys, you will see MCQs. So please do remember these points. 1931. The element fluoride was identified as the mysterious factor by Churchill. Then in 1945, a fluoridation plant was started at Grand Rapids in Michigan. I'm again and again telling you, you will have to remember these dates. In 1969, WHO advocated that 1 ppm of fluoride in community water supplies was a practical and effective public health measure. Also, in 1955, salt fluoridation was started by whom? Dr. Westby. But do remember, in 1955, stainless fluoride dentifrice became the first dentifrice recognized by the FDA. In 1964, first fluoride dentifrice was accepted by ADA in 1964. Okay, and in 1988, first community-based milk fluoridation scheme was introduced in Bulgaria. You will have to remember these dates. Okay. And now please read this Dean contribution in fluoridation and fluorosis. And in this, they have given you 21 city survey. And also the most important thing to remember here is 1 ppm fluoride. So no mottling or any other enamel changes will be observed in areas with water containing what? 1 ppm of fluoride. Now comes the history of artificial water fluoridation. You will have to remember this table. This artificial water fluoridation studies which contain Grand Rapids, Muskegon study, Newburgh, Kingston study, Brantford, Sarnia, Stanford study, Evanston, Oak Park, and Teal, Columburg study. You will have to remember these states, year, country, test city, control city. Okay. And then comes the fluoride delivery methods. You will also have to remember this table because they can ask in MCQs about these percentages. So do remember this table too. Now here are some important points to remember. First is sodium fluoride, which was the first compound used in controlled water fluoridation and is still widely used in smaller community water system. Okay. Then today also we have to remember that most commonly used compound is hydrofluorosilicic acid in USA, as it is less expensive and requires simpler technical handling. This can be used when serving more than 50,000 population. Okay, and now you can see this chart on the screen. So methods by which fluorides are added to water supplies. First one is venturized system for like small towns, small rural communities, and then is solution feeder system, then volumetric dry feeder system, and at last saturator feeder system. Do note that solution of feeder system is the most commonly used and most popular method of water fluoridation that do not depend on electric assistance for water flow is Venturi fluoridation system, and it is a non-electrical system developed by J.N. Lowy. And now you can see this optimal water fluoride concentration estimation. You will see a few MCQs in your dental pearls. So you have to use this formula in those MCQs and apply it. This is Galligan and Vermilion method. Now lastly, let's learn effects of water fluoridation reduction of dental caries. 50 to 70% in permanent dentition. On patent fissures, it is 43%. On proximal surfaces, 74% and 75% reduction in first permanent molar loss. Now for the more information, you must watch part 2 as this was the introduction and the most important part is further in the part 2. So do watch it and do like, share and subscribe my channel. Thanks for watching.